3. Hello, Miss Joanne. How are you today? My name is Sheena, and I'm going to be your student nurse today. Is it all right if we do your bed bath and oral cares?
Yes, ma'am.
All right. Can you tell me your name and date of birth, please?
Joanne Jones, 12/3/56.
Perfect. And one more thing, Joanne, are you in any pain today on a scale from 0 to 10? 0 is no pain at all, and 10 is very severe pain. Can you give me a number for your pain rating?
No, ma'am. 0 pain.
Thank you. All right, I'm gonna set the bath in progress sign on the door so we have some privacy. No one's walking in. Perfect. Okay, now I'm gonna do hand hygiene. I'm gonna put on my gloves. We're gonna set you up to brush your teeth, Joanne, okay? Alright. I'm gonna move your call light and move your TV remote so they're not in the way. Sit you all the way up to your oral cares. I'm gonna set the bed up again, or a little bit. Put a towel over your chest. That is as far as you're going to go, so we're just going to reposition you a little bit here, Joanne, and so you sit up a little bit better. There you go. Okay, so we have your spit basin here, water in the gray cup, mouthwash mixed with water. In the pink cup, toothpaste is on your toothbrush. And get started with that. I'm going to put a barrier over your chest so we don't get all dirty. And while you brush your teeth, I'm going to get your water ready for your bed bath. Okay, I would test the water with my wrist or my elbow to make sure that it's 105 degrees. I would have soapy water in one, clean water with no soap in the other. Miss Joanne, are you all set?
Yes, ma'am.
All right, I would rinse everything off, dump out and rinse. Of course, these would not be on top of each other because one would have water in it, or two, excuse me, both would have water in it. We have lotion, deodorant, and soap. I'll lower that a little bit. I'm going to raise the bed up so it fits my height. This would be dirty. I would throw it in the dirty clothes in there. Okay, Miss Joanne, I'm going to take your pillow out from behind your head. So we're going to support you there. Go ahead. All right. Pillowcase off. If the pillow is soiled, I would disinfect first. You're at a good working height. I'm going to lay you flat a little bit because it's a little bit easier, no breathing problems. If we were doing unconscious oral cares, I would make sure that I had suction ready. I would check for a gag reflex. If there was a gag reflex, I would not put any liquid in their mouth. I would use a toothette. Still, I would clean their teeth around the gums, and then if they did not have a gag reflex, I would rinse or squeeze out the mouthwash off of the toothette as much as possible. So Joanne, we are going to put a bath blanket on top of you here, okay? So you stay warm. I'm going to pull this down just a little bit. We're going to spread this over the top of you here. I think we got to go this way. And then maybe fibbing, I am. Okay. These sheets here, we're going to change the bedding, so these are just going to go right into the dirty clothes. together here. Put some clean ones in the just water and just soapy water. Okay. Bath towel. I'm gonna put behind Joanne's head here so we don't get water everywhere. I would put her shower cap on. It's a no rinse shampoo. Heat it up in the microwave for 30 seconds. And then I would take it off at the end of her cares. Okay, Joanne, I'm gonna take your gown off. Oh, Joyce, help me lift your hand here. Perfect. I would not have thrown it up like that. Perfect. Dirty clothes. We're gonna change your gown after. I'm gonna start with a mitt. I'm gonna be flipping the washcloth in between each stroke. We work usually from furthest side and then closest to you, but for video purposes, I'm just gonna do one side. I'm gonna start with her eye, and I'm gonna wash from inner to outer. So you would do a stroke, change the cloth, stroke, and then change the cloth, and then I would wash her face, behind her ears, and her neck. All right, and then I would pat dry. Perfect. Okay, Joanne, we're gonna wash your hands and your arm, okay? So soapy water I would use with the hand, and I would get underneath her fingernails. I would make sure everything's good. I would switch the cloth arrangement, and I would go from distal to proximal, wiping up, cleanest to dirtiest. I would get in her armpit really good with the soap and water. I would take clean, just water, and I would rinse all of that off, switching with each stroke. Rinse her armpit really well. I would pat dry. After that, I'm gonna do your chest and stomach. So you're gonna be a little bit cold for a minute here, Joanne, I apologize. I'm gonna take soapy water, and I'm going to do strokes. I'm gonna make sure I get under the breast area very well and in the neck, as sometimes things sit there. Make sure there are no skin tears, abrasions, anything like that. We're gonna, I apologize, we're gonna rinse with regular water, doing strokes. Make sure all the soap is off. And now we're gonna pat dry. Okay, Joanne. Miss Joanne, would you like your back washed?
Yes, please.
All right. Of course, I would always wash the back. I meant to say lotion on the back. My back massage. All right, Miss Joanne, if you can just assist with sitting up here. We're gonna wash your back, and we're gonna do strokes here as well. So wash the back, grab clean rinse water, and we're also going to pat dry. All right, Miss Joanne, if you wanna sit back, perfect. I'm going to put you down a little bit further. We're gonna wash your legs, your feet. A little crooked. I'm gonna use bedding is not wanting to work with us today, Joanne. You wanna fix that side? Perfect. Thank you. Okay, I would take soapy water, Miss Joanne, I'm gonna bury your leg here. I would take soapy water and I would wash from the ankle up to the hip, doing strokes, changing the washcloth each time. I would take rinse water and I would do strokes, changing the washcloth with each stroke, and then I would pat dry. I would wash the feet, checking for any skin tears, abrasions, getting in between the toenails, looking for pressure ulcers on the bottom of the feet or the top. Wash really good. Rinse really good. Make sure all that soap is off. And then we're going to make sure that we dry really good. So we're not holding moisture in between the toes. Pat dry. Perfect. Miss Joanne, we're going to do your pericare, okay? I checked the chart already to make sure that she is able to lay flat. She has no issues with that. And raise the bed to good working height because now the bed is flat. Okay, I'm going to bury you a little bit here, Miss Joanne. So we're going to do peri area. We are going to be going in a downward stroke. First, I would change my gloves and change my water, put new soapy water, new fresh water. I would then wash around the area to make sure all the soiled areas and the crevices. And then when it comes to the actual peri area, changing locations on the rag with each swipe, I would do outer, change, outer arm towards me, switch, and then I would do down the middle. I would do that with the soap, with the clean water, down, down, and down in the middle. And then I would pat dry. All right, Miss Joanne, we're gonna cover you back up. I'm gonna go ahead and roll you towards Cassie so we can wash your peri area. Okay. If you can just reach over and grab the side rail, Miss Joanne. Perfect. I would take the soapy water and I would do outside, outside, and up the middle. I would do the rinse water, outside, outside, and up the middle. And then I would pat dry. So we are patting dry. Perfect. At this time is where I would change the brief, anything like that. We're gonna change the bedding. Excuse me, this is dirty. We are going to make a new bed, try to keep you covered and warm as much as possible. I did not use all of my rags, so I'm going to put one down for a barrier. Try to protect the sheets, the new sheets. And we're gonna tuck under. So the new sheets, we will do the drop cloth. We're gonna fan fold, tuck under. Perfect. Next, we're going to do the fitted sheet. Make sure that one's the fitted. Perfect. Sheet. Ensure that the draw sheet is from the shoulders to the hips. We're going to fan fold this as well. Go up. Okay, Miss Joanne, you are going to come towards me. And put this down so we're not hitting your head. We're going to put it up a little bit more, I guess. Okay. Little bump. All right. And then Miss Joanne, you're going to come towards me. Make sure that your face doesn't hit. If the bed was soiled, I disinfect it. Put her up in a chair if need be. Wipe it off or put a barrier, a drop area on the bottom. Ensure that it stays clean. and dry the new sheets. Awesome. Okay, Miss Joanne, I'm gonna lay you back. Put that there. I would change my gloves again because I just completed pericare. I would have done that before putting the new bedding on. Okay. Get this sheet started. We're gonna put a new gown on. Miss Joanne, take the bath blanket off. Okay. So you stay nice and dry and warm here. Put your arms through. Perfect. Tie that around the neck. Put her on. Okay, I'm gonna lay your hands down, and I am going to pull the bath blanket off while pulling that down. Put that in dirty laundry. Okay. You doing okay, Joanne?
Yes, ma'am.
All right, I'm gonna get your pillow for you right now so you have your head a little up. I would have taken the shower cap off as well. We style her hair afterwards. You want to make sure that the tags are on the inside of the pillow. And you want to make sure that the pillowcase is facing the window so no germs get out. Into the pillow, excuse me. Support the neck. Lift up. Okay. And then we're going to take the comforter. Right. Perfect. We're going to fan fold the top sheet to keep the integrity under her arms. Awesome. Thank you for helping, Joanne. I'm going to put this back down. Put your head up a little bit, Miss Joanne. Tell me when you're okay.
Oh, that's good.
All right. We are going to tuck the end of your bed here. And then we'll do mitered corners for safety. Flip under, back over. To ensure my resident has their call light within reach and their TV remote, keeping the cords away from the ground. Miss Joanne, are you thirsty? Miss Joanne, are you thirsty?
No, ma'am.
Okay. I would get rid of these. I would ensure to pull up the bottom of the bed so as not to give drop foot or any abrasions on the bottom of the top of the toes. Okay. Miss Joanne, if you need anything from me, please let me know, all right? I'm gonna get rid of my gloves. I'm gonna perform hand hygiene. And if you need me, just ring your call light.
All right, thank you.
Thank you.